Hello and welcome to my clinical exercise intervention. Meet Patty, a 64-year-old recently diagnosed with osteoporosis. She's currently on Frasamax, an aldrogenate biphosphate. This aims to inhibit osteoblast, otherwise known as bone reabsorbing cells. She's also on letrozole, an aromatase inhibitor. This aims to decrease estrogen to prevent further risk of developing breast cancer again. It also is taken as part of her ongoing breast cancer treatment. Her previous medical history. She's a breast cancer survivor, having gone through lumpectomy, chemotherapy, radiotherapy, and ongoing hormone therapy. She's now in recovery and motivated to get her strength and confidence back. About the client. She's 10 years post-menopause, and like many women her age, she's facing some changes in her bone and muscle health. Her risk factors include a family history of osteoporosis, her mum actually fracturing her hip at 72, plus mild sarcopenia, or loss of muscle mass, and some joint stiffness and fatigue that still linger from her cancer treatment. Before retirement, she was a school teacher, on her feet a lot but never involved in physical activity. Her exercise, however, included a bit of walking and yoga when she was younger, but never consistent strength training. In recent years, she's been quite sedentary, mainly due to fatigue and fear of injury. She lives with her husband, has a supportive family, and she's motivated. She just needs some guidance and reassurance that she can safely build strength again. Now for her patient's personal goals. 1. She wants to increase her bone mineral density and muscular strength. She also wants to grow independence and reduce the risk of falling and increase her balance. And thirdly, she wants to engage in more physical activity and wants to create a healthier routine and lifestyle so she is able to have a more enjoyable life. Now, what is osteoporosis? Osteoporosis is a condition where the bone structure becomes weaker and more porous, meaning the bones are more fragile and prone to fractures, even from a minor bump or fall. After menopause, women naturally produce less estrogen, and that loss accelerates bone breakdown. Combine that with age-related muscle loss, and it creates a real challenge for maintaining strength and balance. That's where exercise becomes one of the most important tools, not only to preserve bone density, but to also boost muscle mass, coordinations, and grow confidence in patients. Here's some statistics. 80% of osteoporosis patients are women. 1 in 2 postmenopausal women develop osteoporosis. 24% aged over 50 are diagnosed with osteoporosis per year, and 89.7% breast cancer patients are diagnosed with osteoporosis after treatment. Now for our types of intervention. First, we have resistance training. A recent meta-analysis published on PubMed confirmed that strength training is the most effective form of exercise for improving bone mineral density in postmenopausal women, particularly in the femoral neck, spine, and hip. This research investigated the impact of long-term resistance and weight-bearing training on bone health. The study found that regular progressive resistance training led to measurable improvements in BMI at such sites as the spine, hip, and femoral neck, 3 of the most fracture-prone areas in women with osteoporosis. It was evidently found that participants who performed 1-hour sessions 3 times a week improved BMI by 2.5 in the spine, 1.7 in the hip, 3.2 in the femoral neck, and 2% overall. For this client, we'll focus on body weight and resistance band movements at first, some squats, lunges, step-ups and rows, and gradually progress towards light dumbbells. By applying regular progressive resistance, we create healthier stress on the bones, and that's what signals them to rebuild and get stronger. Now for aerobic training. A large 2023 study from the Scandinavian Journal of Medical and Science Sport compared 400 postmenopausal women doing either 150 minutes or 300 minutes of aerobic exercise per week. After 12 months, results showed that women who engaged in supervised high-intensity resistance and impact training not only increased their BMD but also showed improvements in functional performance, including sit-to-stand test and gait speed. For this client, that means brisk walking, low-impact cycling, or elliptical work, starting small and working slowly up to that 300-minute mark. This will improve both bone health and cardiovascular endurance. Furthermore, adding on from this allows her to reach her first goal, to improve her bone mineral density. By slowly increasing her quality of exercise to hit 300 minutes, she is able to increase her BMI. Now, moving forward to the 2023 study from the Journal of Science and Medical in Sport. This paper focused on the role of combined aerobic exercise and resistance exercise in maintaining bone and metabolic health. The author found that moderate aerobic exercise, such as brisk walking or cycling, complemented resistance training by improving cardiovascular health, endurance, and mood. Importantly, combining these exercise types produced greater overall health benefits compared to performing either alone. This approach fits our patient perfectly, as it supports both her bone health and post cancer recovery, whilst also maintaining variety and engagement. For our client, this suggests that balance between load bearing and aerobic movement is vital to sustain bone health and also heart health, whilst also ensuring long term adherence through her post cancer journey. Now, for our Yi Jing Jing exercises. A 2023 Science Direct study found that women aged 50 to 70 who practice Yi Jin Jing for 6 months had significant BMD increases, particularly in the spine, thigh, and lumbar region. The research involved women aged 50 to 70 who took part in a 6-month program. One group completed the Yi Jing Jing and resistance band exercises, while the other control group did not exercise. Each group began with a 5-minute warm up, followed by the 12 exercises that focused on slow, controlled strength and flexibility work. The exercises were designed to strengthen muscles and tendons, enhance soft tissue flexibility, and improve joint mobility, all key factors for supporting bone health and reducing fracture risk. By the end of the 6 months, the exercise group showed improvements in bone mineral density, particularly in the spine, thigh, and lumbar regions, whereas the control group experienced a decline. This shows that even low impact, mindful exercises can meaningfully stimulate bone growth and slow bone loss in postmenopausal women. For our client, a 64-year-old female managing osteoporosis after menopause and cancer treatment, Yi Jing Jing provides a safe and adaptable option. It supports her goals of improving bone strength, flexibility, and balance, while also helping her build a consistent, stabilized routine that enhances confidence and independence. Now for her special considerations. When designing the exercise program, it's important to consider the client's medication, Frasamax, an aldronate, which can cause gastrointestinal irritations. So exercise sessions should be scheduled well after taking the medication to prevent discomfort. Each session should begin with a 5 to 10 minute warm up to gently prepare the body, increase circulation, and reduce any potential strain on the musculoskeletal system. In addition, the client is also taking letrozole, an aromatase inhibitor, that can lead to fatigue and joint stiffness. To accommodate these side effects, the program should include active rest days that focus on light mobility or stretching exercises, allowing recovery without complete inactivity. Workout should gradually progress in intensity with careful monitoring of energy levels and joint discomfort to ensure safe and long-term adherence. Now for what to include in an exercise program. There's 4 components. We've got resistance training, aerobic exercise, which mainly focuses on walking, the Yi Jing Jing exercises, and also resistant band exercises that are found in the Yi Jing Jing. Here is an outline of her weekly layout. On Mondays, she is a combined resistance and aerobic workout, doing her planned resistance and also a 30-minute walk. Tuesdays, an active recovery to not overload her to start with, and also her Yi Jing Jing exercises and that 30-minute walk for her active recovery. Wednesday, combined resistance and aerobic. Thursday, we've got another active recovery with just the Yi Jing exercises and the 30-minute walk. Friday, we've got another combined. Sunday, the same, an active recovery. And then Sunday, we're just going to let her slowly relapse the week and give her some time to rest, but also keep an active lifestyle. So, going on a long walk with her partner, with her kids, anyone just to keep her going for that day. You can see on this slide, I've got a layout of what her resistance workout entails. Her lower body involving a squat to stair, a step up, which you want to gradually increase over time, standing hip abduction, upper body, which includes standing or seated rows, a shoulder press, her push-ups. Then for her core stability, we've got her standing balance reach, her seated knee extensions, and her bird dogs, which will be done on her hands and knees. For equipment, we want to have dumbbells, a resistance band, a mat. Now for her Yi Jing Jing exercises. There's 12 of them that are listed below. There's also a link involved and an image that I put into this presentation that she can refer to. We've also got her aerobic, which is just low to moderate intensity, 30 to 60 minutes, a bit longer on the Sunday when that's her active recovery day. We've also got her warm-up, which involves her joint mobility, her dynamic movement, and her activation and balance to slowly warm up her body ready for the exercises. Each session begins with this warm-up, which includes the following. Together, these elements create a well-rounded, evidence-based program tailored to improve bone health, functional independence, and confidence in movement for postmenopausal women with osteoporosis. Here are my references from my articles. Thank you very much for listening and have a lovely night.